happen. I have so many great fond memories of activities and worship services at Zion. I was not a member there, but it's still in my community, and I feel like it's my church home because it was just a part of my life growing up. So we just want to offer you well wishes. We know something's good going to come from this, and if there's any way that we as a council and mayor can assist you, even if it's just words of encouragement, we're here for you, and we just want you to know that.
Thank you very much. I'm delighted to be here. As you were awakened on yesterday, I was awakened in Durham, North Carolina, because I was in North Carolina celebrating my 75th birthday. And so I got back here about 1:45 and saw that the mayor had been there, and we appreciate his support. We have just been overwhelmed with the concerns and support from our community, from our denomination, and it has just been unbelievable. We met this morning as members of our team, and also the bishop and district superintendent was there with us. And we are so, when we talk about support, Nevada Partners came over and said, if you all don't have a worship place, you can have our facilities on the weekend without any charge. That is the kind of support that we've gotten. On yesterday when I got here, also the Nevada Partners had also fixed lunch for us and provided food for the people who were there. So we are just delighted. And Mayor, I understand that you want to be a part of our community celebration. We will have a community celebration on Tuesday night at First AME Church at 6:00 p.m. for the community to come out and to share with us as we celebrate not the demise, but the resurrection of new life in the community. And we just want to say thanks to all of those people who have called and offered whatever assistance they could give us. So thank you, and thank you for this opportunity for coming.
Thank you. Mr. Brown, did you have anything to offer?
I would like to say thanks to you for coming out yesterday and talking to some of our members. They were delighted. They couldn't believe that the mayor had come out there, but you were such a joy to us. And having known you as long as I have, and I would like to think we're friends, having worked for North Las Vegas and retired here as the assistant chief of police, I have been retired now, and of course my wife says she's teaching me how to be retired, and it's kind of tough sometimes when you've been used to working all your life. I've lived in North Las Vegas for 54 years, and I've gone through a lot of things with the city, and having the joy of having people like we have in North Las Vegas come and see about us. You can't explain it, how I feel about having people like that help us. And we've had people throughout the valley, in other states even, contacting us to offer their support. So thank you all for having us here.
Thank you. Sure.
I'd just like to say that we're leaving here. We're going to Desert Springs United Methodist Church. They're having a concert to benefit our building program. So thank you very much.
Thank you very much. Appreciate you, gentlemen.
Thank you.
Moving on to the agenda.
Item 1, approve City Council regular meeting agenda of June 7, 2017, for possible action.
Good evening, Mayor and Council. We have one change to tonight's agenda. Item number 4 is withdrawn by the appellant. So the recommendation is approve the agenda as amended.
Thank you. Any other? That's it. Call for a motion to approve the agenda as amended.
So moved.
Thank you. We have a motion. Please cast your vote. Items approved. Moving on to set future public hearing dates.
Item 2, set date on any appeals filed or required public hearings from the City Planning Commission meetings.
Thank you, Madam City Clerk. I so direct you set any dates as necessary. Moving
Mayor?
on to the public
Mayor, so
hearing.
noted. Item 3, deny UN 0417 Bourbon Street Sports Bar for applicant and property owner RREF IIKI Promenade LLC for a special use permit in a C2 General Commercial District to allow an on-sale restricted gaming establishment on property located at 775 West Craig Road, Suites 152 through 160, continued February 15, March 1st, April 5th, 2017 for possible action.
Thank you, Mr. Garcia.
Before you start, Mayor,
Yes, ma'am.
Mr. Mayor, NRS 281A.420 requires me to disclose a conflict of interest. The matter before this body involves my campaign manager, who is a representative for the owner of this particular establishment. Therefore, even though I conclude that the independence of judgment of a reasonable person in my situation would probably not be materially affected by this relationship, because it is a clear case of a disqualifying conflict of interest, I will be abstaining from voting in this matter.
So noted. Mr. Garcia.
Mayor, members of the council, George Garcia, 1055 Whitney Ranch Drive, Suite 210. Pleasure to be before you, and with me is Jeff, if you'll introduce yourself.
Jeff Donato, Sandy Law Group, 6077 South Fort Apache Road, Las Vegas, Nevada.
Mayor, I'm sure you and all the council recall the last time this has been before you a couple times previously. The last time we had asked that this item be continued so we could specifically go back and meet with the neighbors to discuss the project and get into some details to see if we could resolve this matter in a favorable light for everyone. We did have a neighborhood meeting. We actually sent out notices even further than the city requires. We went out to 1,800 feet out. We had a huge mailing list. We had good attendance, and we actually have some of the results of that. And Jeff can provide those copies if you want to send those out. But basically, what this reflects is essentially of the people attending. We had 15 people in support. Jeff, is that right?
It was 16 people that attended the neighborhood meeting. Of those 16 people that attended the neighborhood meeting, of those 16 that provided us comment cards, there were 10 comment cards in support and only 1 comment card in opposition.
And what the neighbors asked of us, after quite a bit of discussion, explanation about the project, there was one thing that they said that they would ask, and this is those who objected, not everybody that was, of course, objecting, as Jeff indicated, but of those who had some concern or objection, they said, well, look, there's one thing you could do that would make this project acceptable that we could really live with. And they said, would you please move the project where it's facing Craig Road? So if we can go to the overhead, what you can see here is what we did is where previously the project was located here. This is Craig, here's Revere. We were located on the west side facing Revere. What we've now done is relocate the project into this area here, basically in the crux between the bend and the building. And so what the effective result of that is that as you go to, in terms of walking distance to the residential areas, as we go to the west towards Revere, we're almost 850 feet to the nearest residential. If you go further west and down Revere to the residential to the south, we're at that point almost 1,800 feet walking distance. And if you go to the east and you go that direction, we're almost 1,300 feet going to the east to reach the residential. So I think there's been quite a bit of discussion about the adequate barrier, and I think that discussion is, certainly your call and how you feel it works. But we want to let you know that we've worked with the neighbors and we've accomplished, I think, the goal that they asked us to accomplish. And as Jeff indicated, there were many in support as well. And with that, Mayor, we'll conclude our presentation, be back with any questions you may have or responses.
I'm going to turn it over to, I know you went to the meeting, right? I just have one question. At one time, and I just remembered there's some discussion about the park across the street. Do you remember any discussion about that?
We had, the question was when we talked with Cass, basically, not across the street, to the park to the south.
To the south.
To the south. There's some repairs that need to be done there, and we've been working, in fact, I have to tell you and actually appreciate both the chief had a representative at the neighborhood meeting, so you had an officer at the neighborhood meeting who was able to answer the neighbors' questions. We also had Cass Palmer himself attending the meeting, and so we appreciate Cass attending. And as I've indicated to the councilwoman on this, as well as Cass, we're happy to work not only to repair the wall that's a common wall between the park and our property. our properties, get that wall repaired, and then at the same time work with the park director to find some things that we can do to make that park more attractive and conducive to the neighborhood that we're a part of now.
Okay, I just remembered that discussion. Ms. Brown?
Thanks for that presentation. I think there was great dialogue at the last community meeting, and there were more residents there in support of than opposed at that particular meeting. However, with the change in location, so it is facing Craig, I think is a great compromise on both parts, and I think the residents will be pleased.
I was going to call up just for a second, I'm going to call public comment on just for a second, and then we'll follow from there.
Okay.
I have two people here that would like to speak on this issue. We'll open this up to public comment. Mr. Bouchard, and then following him, Mr. Anton Tyler, if you're in the room. Okay.
Okay, since this was on the agenda last time, I had a chance to do some research, and these places, my understanding is they don't have any live entertainment. They don't really have a food price. It's just another bar. We don't have enough bars in this town. I'm telling you right now, when me and my girlfriend go out, we want to go someplace to hear live music, some stand-up comedy, you know, not that we don't get enough here at the city council meetings, but, you know, the casinos have all dropped the ball on live entertainment. I'm telling you right now, I have a large group of friends who are professional musicians that are starving to death in this town. This is supposed to be the capital of live music and live entertainment, and musicians are now on food stamps. I mean, you can't make a living in this town anymore. I think if we're going to issue more liquor licenses and stuff, it ought to come with the premise they're going to build a nice place with good food, live entertainment, 7 nights a week, because that's what made Las Vegas great. Why not go back to the old formula again? Give people what they want. That's my 2 cents.
Thank you very much. Mr. Tyler, please come forward.
Good afternoon, Mayor and Council. In the previous discussions which I brought to you, I brought some considerable number of signatures who were opposed to the positioning of the tavern on opposite Revere. The view of most of those people who are not here tonight, because they're basically conceding that the change in location makes them a little happier, because it is not going to have the children passing the door of that tavern every time on their way to the skate park and to the basketball, which makes you or be in charge of one of the most popular parks in the city now, something that we're all very proud of. However, we realize that in fact some of the planning permissions which you previously had to waive, there were 3 planning provisions you had to waive before for the Revere position, have now been reduced, in fact, I think, to 2, based on the distance from the residential sites on Revere. Our position, in fact, is even though you're going to have to waive those, we will not oppose as vigorously the current positioning, but we would like to make sure that there is no attempt on the part of the properties to move them back to the original position. After all, it's only a change of suite number which would be required to do that. So in the application, we need to be very precise on exactly where they're going to be positioned. And with that thought, I'll leave it with you.
Thank you very much, Mr. Garcia. Just to rebut.
I think the answer is we're happy with the location. We've now indicated the compromise for, and I'll leave this exhibit behind for the record. We've already provided a copy of the location to the planning department, and I think that location is acceptable to both my client and the landlord, and we'd be happy to then answer any questions, or hopefully you would feel comfortable to move forward on this then.
Thank you. Before you leave, is there anybody else that'd like to speak on this issue? We'll close public comment. Council, do you have questions? Councilman Barone?
Yes, thank you very much, Mayor. Actually, What is it even possible for them to change if, like, later on, to the gentleman, to Mr. Tyler's concern? Is there even a process for them to change suites in the future if they wanted to?
Still, I don't see why.
I,
I don't see
I'm just
why they would
trying
want
to
do that. I don't
address
think that
his
feasibly makes-
concern. That's
or
all.
financially makes sense. I don't know, George, you
I
guys
think
can answer
that
that.
it's
more.
on the
I mean,
record.
I think we're fine with this location,
Yeah.
you know, so we don't have any intention to relocate. The reason we're relocating here and redesigning is because this is planned to be our location, and I can guarantee you, my client is not going to, move in without coming back to the council and having a discussion. If you want to make that a condition of approval, we'd certainly agree with that. That's fine.
Would that be okay if we could make it a condition of approval? That if they wanted to change it, they would have to come back and.
Yes. Councilwoman?
I'm okay with that.
So, Renee, if there's no more discussion, the chair will take a motion.
Well, I move to approve.
We have a motion. Please cast your vote.
Well, in that case, if I move to approve, I mean,
With your amendment.
with the amendment and not to deny, but rather to approve. That's what I'm motioning.
Yeah.
Does that make sense?
Yeah.
Okay.
With the condition.
With the condition.
Items approved.
Mayor and council, thank you.
Thank you. At this time, the withdrawal by the applicant has taken place on item number 4. We need to get Ms. Wood. Oh, okay, thank you. So moving on to number 5.
Number 5, approve VAC 0717 Northgate Building 3 for applicant Tracy Hammer, property owner PHI Northgate Building 3 LLC, to vacate a drainage easement located at the southwest corner of Donovan Way and Tropical Parkway, extending south approximately 640 feet for possible action.
Thank you. Anybody like to come forth and offer public comment on this? I have no blue cards. We'll close public comment. Council, the chair will take a motion.
Move to approve.
We have a motion. Please cast your vote. Items approved. Moving on to the consent agenda.
Matters listed on the consent agenda are considered routine and may be approved by a single motion. However, any consent item may be moved to the business portion of the agenda for discussion at the request of any council member.
Mayor and Council, consent agenda consists of item number 6 through 15. The recommendation is approved as published.
Thank you. If there's no more comments or questions, the chair will take a motion to approve the consent agenda.
Move to approve consent.
We have a motion. Please cast your vote. Items approved. Moving on to business.
Item 16, accept and approve report from North Las Vegas Office of Emergency Management and Galena Properties Consultants regarding the newly revised Continuity of Operations Plan and Continuity of Government Plan in accordance with NRS 239C.260 for possible action.
Thank you. Welcome back, Carlito.
Thank you, Mr. Mayor. Good evening, council, staff. Carlito Reyes, North Las Vegas Office of Emergency Management. Tonight, I'm joined by Mr. Ron Percival from Galena Property Consultants, who has done some tireless work with us and with Salome and myself. Tonight is kind of the culminating event after 9 months of work meeting with all the city departments, all the directors, deputy directors, and managers on how we would function in alternate work locations if our daily operations were impacted. So with that, I know that Mr. Percival has limited time, so I'm going to turn it over to him.
All right, thank you, Carlito. Pleasure here. Thank you very much for allowing me to take a little time and giving you a little rundown on the continuity of operations and continuity of government. Now, continuity of government we affectionately call COG, and the continuity of operations is called COOP. So if I may use those interchangeably. You wonder, what is COOP? Okay, we're just going to go through. Well, it is how you stay operational after an emergency or disaster. I like to use this particular scenario. Fires burning up your office building. You got 50 people sitting in there. You're required by law to run outside, and you all get out there. Okay, the fire department comes in, they put out the fire. Now what do you do? Where are you going to work tomorrow? How are you going to stay operational? How are you going to keep your citizens ready to go? That is what COOP basically is. Now, the COOP documents, I'll just give you a quick rundown. What will occur in a continuity situation, how quickly continuity actions must occur, where continuity operations will occur, alternate work locations, and who will participate in the continuity of operations. I'll have to let the council members know. Councilmember Chirkicho had been around, and he had been coming back and forth, so he's pretty well familiar with this. We had participation from every department. Really good work. COG, COOP, and disaster recovery plans, it's an all hazards approach. It works no matter what happens, what disaster, what type of situation. Where emergency operations plans, they're specific to different incidences. So in other words, you have a fire, you're going to take care of that. You have an evacuation someplace, you're going to go take that. Where continuity operations in COG, it's all hazards, no matter what. Now the phases of continuity, it's two federal statutes, Federal Continuity Directive 1 and Continuity Guidance Circular Number 1. They talk about the 4 phases of being prepared. Readiness and preparedness, activation and relocations within 0 to 12 hours. Sometimes that's not that easy to do, but that's what's looking at. Continuity of operations, you may be there from 12 hours up to a possibility of 30 days until resumption of normal operations. Phase 4, reconstitution, recovery, mitigation, and termination. Now, COOP and COG is a state law. State law requires plans for continuity of the operations and services of the political subdivision consistent with NRS 239C.260. Why do we do this? Well, Las Vegas urban areas has their biggest threats are active shooter, chemical hazmat release, cyber attack, drought, earthquake, flood, pandemic, and wildfire. And this was just promulgated back just in 2017 by the state and the urban area of Las Vegas. This is why we do continuity of operations, to take care of any possible situation, emergency, or disaster. As you know, we're the 3rd most actively seismic state in the union, only followed by we're behind California and Alaska. You know, that's people realize some people move out to the state of Nevada saying, well, we don't have earthquakes out here. Oh, yes, we do. Quite a few. And otherwise, why we do it? I'm a little stressed right now, cannot think clearly in stressful situations. Good example of that, when you have a situation where you have to go dial a phone, normally you can do it in 15 seconds or your cell phone. In a disaster situation or a situation you're put under stress, that goes up 3 times to 45 seconds. If you're ready, that cuts that down quite a bit. And ethical responsibility. Good to know that your city is ready to go no matter what. You have your citizens at heart. You're able to stay operational. That's the reason why we've done these plans. Public relations, it is very good for public relations. You can let your citizens know that we have a continuity of operations and we have a continuity of government plan in place, ready to be activated on a moment's notice. If Carlito says we need to activate, we'll activate. Peace of mind. You know all departments are ready to go and they're ready to go. Who? All agencies of type, all agencies, all locations. This guy, what business continuity plan? We use interchangeably COOP and business continuity. Private sector uses business continuity. We call it COOP and government. How do we do it? COOP and COG is developed for all departments by interviewing staff to complete their worksheets. That's what we did. We spent the last 4 to 5 months meeting with all the departments down here, sitting down with department heads, their assistants, and getting all the information into this plan. Included in the plan, this is where it gets pretty good. There are 10 elements that are all included in this binder right here for each department. And this goes to Carlito. Each department has their own worksheets, their own electronic worksheets. The biggest ones here, how do you stay operational? What are your essential functions? The other one basically is, your biggest one is your resources. What software do you need in order to stay operational? If you've got to go to an alternate location, how do you stay operational? What do you need? COOP is a living document that needs continually updating and changes. It's always evolving around. That's it, folks. That is basically COOP. And now what I want to tell you, one other thing here too. In summary, the city departments were on board with this project and came to the interviews with great information. Some of the staff had little experience in the process, but once we talked them through each element of COOP, they understood the importance in being able to stay operational during and after any emergency or disaster. Carlito and Solomie were able to get support from each department, were invaluable in setting up meetings with each department, assisting us during the departmental interviews. The city of North Las Vegas is well prepared. Right now, we're going to have an exercise tomorrow morning starting at 10:30, and believe it or not, we have all departments showing up. So it'll be it's always a lot of fun. With that, there's the document right there. There'll probably be some changes in this. I thank you very much. Carlito? Yes.
Pending your questions, sir.
Any
That's all we
questions?
That's good. Council, any comments or questions? Ms. Woods?
So I have no doubt that when it comes to dealing with emergencies, that we've got great staff and they're ready to go. But certainly staffing has been an issue in North Las Vegas. How is the fact that we are as understaffed as we are impacting the COOP and the COG, and how do we deal with that? I mean, is part of this plan, how do we deal with that going forward?
We took that into consideration, and we're going to validate this plan tomorrow. One of the biggest things, Councilwoman, is that we like to apply the 1/3 rule, the 2/3 rule, right? So we know that 1/3 of general employees will not show up because they can't get here because they're impacted by the disaster themselves. 1/3 will have to take care of their own families, and then 1/3 will show up. All right. And so if you do that, and your mission is already impacted by location, by your resources and your tools, and a shortage of up to 2/3 of your staff, it's going to be hard for anybody. So whether you're completely staffed out or not, that's kind of what this plan is for. What essential services do we need to get done in that initial response? Which ones can kind of wait for a while until we can get them back online? And that's what this does. It prioritizes that normal operations until you return to normal operations.
And Carlito's actually, we use that third rule. It's not normal operations. It's not business as usual. You're going to be understaffed. But the whole key to this is that you want to be able to stay operational. You must stay operational for your citizens on the critical task. You have to be able to be ready to go. Maybe not different locations, yes, but that's pretty much it. Any other questions?
Any other questions? Richard? Councilman?
I just wanted to say thank you for that presentation and the training that you did. It was really very, educating and very interesting.
Thank you.
You all did a great job. Thank you so much for
Great year. Thank you very much, everyone.
After the RTC meeting, whenever it gets over, Carlito, I'll swing by. Okay, thank you very much. So what we'd like to do is call for motion to accept and approve the report.
So moved.
Please cast.
Now, excuse me, question of clarification. So is this is not the report?
That's just a
This is just a presentation. We haven't
Actually,
seen the report, so exactly what are we approving?
This report is being handed to us now, and it's a living document, and it'll change as situations
We
arise.
already have a plan. This was an update to the plan.
So an
So
update to
the
the
agenda was
report?
just a report on the updated plan.
Okay, it didn't say that here, so so it's an update of the report then.
Yes, sir.
Okay. So do we have a motion?
Yes, we do. So moved. Passing it up.
Your motion, please cast your vote. Items approved.
Thank you.
Item 17, authorize city attorney to retain the law firm of Santora Whitmire to initiate litigation against Travelers Insurance for failure to provide coverage for certain damaged air conditioning units for possible action.
Thank you. Seeing no blue cards, the chair will take a motion to authorize retention of this law firm.
Move to approve.
Please cast your vote. We have a motion. Items approved.
Item 18, receive presentation by Southern Nevada Community Health Improvement Program and its involvement with the North Las Vegas community for possible action.
Thank you. Ladies.
Good evening. Lisa Price, CMS Chief, North Las Vegas Fire Department.
Last September, North Las Vegas Fire Department partnered with Southern Nevada Community Health Improvement Program, also known as Southern Nevada CHIPS. In September, we received 2 UNLV social worker practicum volunteer students. Those students have developed a referral process for our firefighters in the field who identify potential social service crisis citizens. In April, our students provided the training for the referral process to our firefighters. And since April, we have received 16 referrals from our firefighters. 6 of those referrals actually received service from our students. 4 denied, and 6 were unable to be contacted. So I think, thank you for receiving this informational presentation, and I think you'll see the great value that the CHIPS organization provides to North Las Vegas. So without further ado, I present to you Sarah McRae and Alexandria Anderson.
Thank you.
Mayor and Council, thank you for this opportunity. Again, I'm Assistant Fire Chief Sarah McRae from Las Vegas Fire and Rescue. Do we have the PowerPoint? Can you see it? Were you not? I have one. I also have an electronic copy if you want it. I'm sorry, I thought that you had that information already. We can do that. Okay, excellent. All right, so Southern Nevada CHIPS, Community Health Improvement Program. I'm going to talk a little bit about the history and what exactly they're doing here. So as you know, your fire department provides first response. So what exactly is a first responder? It's somebody designated or trained to respond to an emergency. And what do? They have fire alarm office where they have call takers and dispatchers interfacing with the public and determining what level of emergency that is and what kind of resources need to respond. You have prevention inspectors to work with your fire prevention building codes to make sure that buildings are safe in your community, fire suppression to put out those fires. Emergency medical services, where they're trained, and I'll get into a little bit more detail there, to mitigate medical emergencies. Special operation teams like hazmat, technical rescue teams, and fire investigations and arsons, right? After you have the fire, why did this happen, and how can we either put arson people behind bars or work with our fire prevention division so that we can influence safer building codes. We are all hazard response, trying to get on scene in less than 8 minutes. How do first responders interface with your public health? Mostly in the emergency medical services arena of what we do. Who are they? They're EMTs, advanced EMTs, paramedics, sometimes EMS RNs. You have your medical director, and they work under a set of protocols that have been written by your Southern Nevada Health District Office of EMS and Trauma Services. What have they been trained to do, and what kind of protocols do we have? We have protocols for cardiac arrest, heart attacks, strokes, severe respiratory distress, traumatic injuries. So these are really emergent situations that are time sensitive and require quick intervention. But so much more. In fact, almost 90% of your unit responses for your fire department are EMS in nature. And if there's ever any questions, please by all means let me know. So if we were to look at those a little bit closer, when we receive the call in the dispatch center and we go through that triage, we ask a series of questioning and we try to identify those highest need emergencies first, such as a cardiac arrest, CPR in progress. We're going to call that an echo. That's our highest level of response. We're going to send up to six people or more. That's because we know that this is a time-sensitive emergency that's going to require a lot of manpower to get that person back to health if possible. As we go through that tier, depending on how they answer those questions, it could be a Delta response, which is going to be like a severe respiratory distress, but not CPR in progress cardiac arrest. A Charlie response, which is now we're talking about heart attacks, strokes, where this person is having a time-sensitive emergency that needs to go to the hospital by ambulance and receive intervention en route. Your Bravos are kind of more your unknown. There's some element of we're not quite sure how serious this is, but we suspect there might be a problem. We need to send a unit out, code 3. And then your Alpha, where this is somebody that might have a headache for 3 weeks, like literally abdominal pain for 3 weeks, a stubbed toe, a sprained ankle, some minor lacerations. So those are lower level responses. So if we look at the different types of responses that we have, this is a pie chart of the different kinds, and I'm sorry this doesn't show up very well. But in the this small slither of the teal right here, that's your echo. So when we talk about all those hundreds of thousands of calls that Las Vegas Fire and Rescue ran last year, a small percentage of those were actually echo nature responses. And a higher percentage of those are in the Alpha and Bravo. And on the PowerPoint, it actually showed the percentages. But we're looking at these two right here being in the Alpha and Bravo categories, so your lower level responses. And this explains it, especially when we talk about recession, people out of jobs, without health insurance, transportation, public transportation is lacking. Access to care is a challenge. Nevada ranks in the bottom in terms of how many doctors we have per capita. And so what happens is, because 911 is reliable and free at time of service, it becomes that access point to service. So you have an ambulance or a rescue that goes out, transports this patient to the hospital because that's our only option. That's what we do, right? I just described all the things that we're trained in and what the nature of our protocols allow us to do. We transport to the hospital. And if that situation is not mitigated, and the real reason why they're calling 911 is not actually solved in the hospital, this cycle just will continue. And so you just continue to have this cycle in and out of the hospital, utilizing your 911 and EMS services, continuing to increase the volume of calls that we receive year over year, which is on average 8 to 10% of an increase every year over year. These are the reasons why people are actually calling in those lower level emergencies. They don't have access to primary care. They don't know how to fill their prescriptions. They think that if they go to the hospital, they can get their prescription renewed or get another week's worth or something. Food security, behavioral health issues. They don't have other transportation means. They may be lacking mobility. We get a lot of lift assists, especially with our elderly population as they're transitioning into higher levels of needed care and assistance. They don't have shelter, right? So they're not able to get into a homeless shelter for the evening. It's either really cold or they're hungry. And then, of course, substance abuse. We have a lot of substance abuse in our community. So kind of recollect on everything we just went through. These are the services that we're trained in. These are the services that we provide from an EMS perspective. But 18 to 53% of the time, these are actually the services that people need when we arrive on scene. And again, our protocols are limited to transporting to the hospital and providing emergent medical care. I can speak on behalf of Las Vegas Fire and Rescue. This is how we've handled that problem in the past. And if you could zoom a little bit more for them again, please. As our call volumes increase, and because we want to maintain our unit readiness and response and keep our response times down, we have to open up additional stations, we have to man additional units, and those are expensive. So in Fire Station 106 opened in 2012, and that's the cost. Fire Station 107 as well, that was the cost. 108. And so a total cost of 3 additional stations to manage this additional call volume comes at a very high cost, aside from not providing the service that the person actually needs. And that's where we get to Southern Nevada CHIPS. So I attended an EMS conference in April of 2013. At the time, I was in the role of EMS Quality Improvement Coordinator for Las Vegas Fire and Rescue, where I was basically trying to hold my crews accountable for providing excellent care during those highly sensitive, time-sensitive intervention patients, such as intubations, cardiac arrest, heart attack, when so often they're running on patients that aren't falling under those categories. And so I'm looking at ways from a quality side of things, is how do I focus and get my crews doing what they're trained to do, right? And take away the things that they're not actually excellent at. And the metaphor I use often is that it's like sending an electrician to fix a leaky toilet. They get frustrated over time, and it's never going to really repair the toilet, right? Just going to leak away. And the electrician's frustrated. So that fall, after going to this EMS conference and seeing a presentation from a chief in Spokane, Washington, where he was using local students from the university, receiving referrals from the firefighters and paramedics in the field, and connecting those social work students with the people in need in the community, came back and established that same partnership with UNLV. We started with 2 students. I was blessed with Alexandria as a student in the spring of 2015, so about a year and a half later. We would just not have continuity of operation during student and academic breaks and just do what we could when we had students. She came to me in January of 2015, and I challenged her with sustainability. And so here we are today. In the fall of 2015, we expanded to Clark County Fire Department. And then in the fall of 26, we expanded to all 4 fire departments in the valley and had over 20 students. And also in the fall of 2016, we expanded our partnership in UNLV with the School of Nursing so that we could additionally bring in that health perspective. So we're sending nursing students out on certain cases so that they can do like a home health assessment, mini mental health assessments, activities of daily living, go through the house and check for slip and trip hazards. And then we were also awarded with a 1-year dignity grant this year, or I'm sorry, it was this year. We were awarded last year and given the money this year, yes. And then we are now in contract with Las Vegas Fire and Rescue, City of Las Vegas, with Southern Nevada CHIPS so that we can maintain the sustainability and have continuity of operations through the academic breaks. And we are continuing to grow every year. And now I'm going to go ahead and hand it all over to Alexandria. She's going to talk about the outcomes of the program and a little bit more in specific about what they do. Thank you.
Good evening. My name is Alexandria Anderson. I'm the Executive Director of Southern Nevada CHIPS. So as Sarah said, we now partner with all the local fire departments, Clark County Fire Department, Henderson Fire Department, Las Vegas Fire and Rescue, and of course, North Las Vegas Fire. So this is outcomes from a month earlier on in the program. We just kind of wanted to give you some numbers of what we have. When we pulled these numbers, we were doing everything telephonically. We now have the capability to go out and do home visits, and we've added the nurses, so we expect our outcomes to be even greater moving forward. Here's a breakdown of the demographics during that sample period that we have. As you can see here, the highest age number is actually between 51 and 60. A lot of that is because as people are approaching 60, health is beginning to decline for a lot of people, and they don't yet have access to Medicare services because they're not 65 and older. So a lot of times they're the ones that kind of falls in that gap of not having services and not knowing how to access health care as well as social services that they might be eligible for. So the outcomes, what we do basically is we provide access, navigation, advocacy, and education. So we get a referral from a client. We first want to see kind of what their income base is, what access they have. Are there things out there for them? And if there are not things out there for them in the community, then we want to identify that. How many times is this happening that this particular group of people, whether it be income or zip code, they're needing this particular service and it's not available? So we do a gap analysis with that. The next thing is navigation. A lot of times people know the service is out there, but they don't know how to navigate it. That means they don't know how to fill out an application, who to get it to. It has to be returned within 10 days, but you have to have a printout of X, Y, and Z, and you don't know where to get that from. And so they kind of just throw up their hands and just say, forget it, because it can be difficult. So we help through those processes. A few times we've gone out to see a client, and it was an elderly client, and we literally just sat on the phone with their insurance for them for an hour so that they didn't have to sit there and do it. In addition, we provide advocacy services, so when clients aren't getting what they need and they're entitled to, then we'll facilitate that for them. Sometimes you can get a better response from someone from an agency than you can from the individual. And then we provide education. Sometimes that education is about fall risks or just other services that are available to them. So in this sample month, what we do is we look at the number of 911 calls 90 days prior to intervention and then 90 days post-intervention to see what the difference is in the number of calls. So of that sample period, we had a total of 49 clients, 15 of which denied services. 21 were unable to contact, and again, we expect that number to be reduced because now we do home visits. At this time, we were just doing everything telephonically. 13 people accepted services. Of those 13, those 13 people had a total of 24 911 calls pre-intervention, 90 days pre-intervention. Post-intervention, they had 9 calls to 911, which was a 63 reduction in use of services. Some of the interventions that we give are mental health, medical supplies, primary care, transportation. We have actually just gotten a partnership with Lyft, and so for those folks who can't get their insurance to provide transportation to medical appointments, maybe because it was on the 24-hour call list and they just got the appointment that morning, we can facilitate those transportation needs for them. And then just want to go over a couple scenarios so you kind of have an idea of some of the calls that people called 911 for. We've gotten a referral for a 60-year-old woman who called 911 because her family didn't want to deal with her anymore, and she wanted to go to a hospital to get away from them. So obviously everybody in this household is frustrated. They have some type of need. Not sure that it was 911, but that's what they chose to utilize. The next one is a transitional and permanent housing facility called 911 because one of their residents needed assisted living, and they wanted the hospital to hold the patient until the hospital could arrange housing for this individual. Another referral was a 60-year-old male who called 911 because his electric recliner was not working. We have an elderly female who calls because she's lonely and she wants someone to play cards with her. Of course, she knows the system well, so when she calls, she says that she has shortness of breath, and then they get there and she just wants to play board games with them. This is actually a client who actually suffers from dementia, so there's a lot of services that she actually needs that won't be facilitated through her calling 911 and then not being transported to the hospital. And then the last one listed here is a diabetic 30-year-old calls 911 because he's been out of his medication for a few days and now he's feeling nauseous, his kidneys are aching, and he has dry mouth. So of these, that will probably be the one that's like, okay, that might warrant a 911 call. But in addition to that, there's still an underlying issue with that last call that won't be solved by calling 911. So for that family who is frustrated dealing with their loved one, they actually need respite care for the family and then possible placement for the elderly woman. For the transitional call, they need 911 education on what you're supposed to call 911 for, as well as information on facilities and housing. They're a transitional housing place, so maybe they don't know about permanent housing ones. And the electric recliner guy, he actually had a substance abuse issue. The lonely woman, she needs companionship, or like I mentioned, she actually has some dementia going on there. So there's actually a number of services that we are in the process of linking her with. And then the man with diabetes, he needs diabetic education and treatment so that he can learn how to self-manage his diabetes. So these are all services that we provide to these clients. And we look throughout the valley in different partners to connect them with them and make sure that they have what they need. And that's all I have. Thank you. Any
Thank you.
questions?
Very, very good presentation. It's interesting calling the electrician out to do the work of the plumber. I agree with that. I was a plumbing contractor, but I would not call a plumber out for electrical work for sure. Very good. I appreciate this. I almost called 911. I couldn't find my remote. I didn't know what to do. I said, I'm calling 911 for my TV. So people do call 911 for most irresponsible reasons, but they do know there's somebody on the other end of the line, and it's very important that we get the services to those people who really do need the help. I'm sure some of the council has some. Councilman Woods?
No, I think this is a wonderful program. I mean, as I've been learning about a lot about what our fire department does, in particular paramedics, certainly healthcare has become a vital key topic. And particularly now, as we're seeing as much as we are about, are they going to overturn Obamacare and all this stuff, it makes it hard for people that do not necessarily always have access to their medications and maybe now don't have insurance for a break of time and wondering how do they go see their doctor. They can't afford it. It becomes an issue of, do I eat or do I take my meds? And they have to start making these decisions. And of course, okay, we'll eat, but I won't take my meds. And 3, 4, 5 days later, all of a sudden, they start feeling the after effects of not, and they still can't afford to go to the doctor or to the hospital, and 911 becomes the answer, and it puts you guys in a difficult situation because you can't be everything to everyone, but everyone's looking at you to do that, and so I think this program is a great way of trying to help those people get the resources and assistance that they need, so that we're not overwhelming 911 with calls that shouldn't be, and then freeing you up so that you can focus on the true 911 calls that no one else can handle but you. I think it's an amazing program. Thank you for bringing this to our attention.
Thank you very much. And I think you touch on a very important topic about healthcare, but also that we are recognizing more and more that the social determinants that have a bigger impact on healthcare than really the interventions we're receiving at the hospital. And that if they can't follow up and see their doctors and take their medications and don't have food security and shelter, then they will never get better. And so it's wonderful that we finally have a tool in Southern Nevada CHIPS from an EMS perspective that we can refer these people over to a program where we know that their needs will be met. And they will actually get the benefits, because there are a ton of services out there in the community. Right. And I say that even for me, I have a couple of smartphones and internet access, and I still struggle knowing who to call. And we take we assume a lot of things for the citizens of our community, that many of them don't have those same resources. And so it's nice that we have an advocate in the community for those people and that we're utilizing our EMS agencies to identify those vulnerable members in our community. And it's a really wonderful partnership.
Councilwoman Brown?
Thank you for that presentation. When you have people that deny services, or let's say I have a family member that I know is in need, or you talk to that person and you know they are in need, do you have a means to try to convince them, or how much do you go back and say, I know we can really help you, and they can still decline, or do you just keep going after them?
So as a social worker, we have to give people the right to self-determine. But I always tell my volunteers and my workers that if someone declines, just say, well, okay, I understand you don't want our services. Is it okay if I call and check up on you next week? And 9 times out of 10, they'll say yes. And then if you actually call to check up on them next week, then they'll start to kind of buy in, like, oh, okay, well, so and many times that's what we do. I had a client who was extremely resistant. She was living in a black mold-infested home. And the first time I called her, she didn't want services. And I'm like, well, can I call you next week? And she was like, fine. So the next week I called her, and then she was like, I don't want to talk anymore. And I'm like, okay, I'll call you next week. It took me about 8 months to really build rapport with her, but we finally got her. She had lived in the home for over 50 years. We finally got her to move out of the home and move to a more safe environment. And now she's doing well. She's maintaining her new home. She does still miss her old home. She has many memories there, but she's doing well. So yes, we don't just take no for an answer very easily.
Councilman Churchio?
That's a great program. I think I fall into the I've passed the category of not having health care, so I'm okay right now. But I am concerned about that guy in the electric, recliner. If he was stuck in it versus not being able to get it to work. I mentioned at my briefing, I kind of asked a question, and I understand the program a lot better now. A lot of insurance companies are providing proactive services, Blue Cross Blue Shield, nurse services by phone, rather than go to the doctor. It's a cost containment measure, and it's an educational thing too for the the clients, for the people covered by the plan. But how do you get this? Are you proactive in this or reactive? Is there any way for you to? I want to make sure I'm understanding this program. Is there any way for you to not have to wait until you get these calls from those people to get back with them and try to educate them proactively, the community, so to speak?
Yes. So we do go to a lot of the community outreach programs, the community outreach events to give information on 911 and access and things like that. We take referrals at these community outreaches as well. One of the issues is our most vulnerable populations, they don't go to these events. And sometimes they're isolated and in silos, so they're hard to contact. But one way that we are trying to this is one way that we're trying to reach them. Another way, if we started a pilot program with Sunrise Hospital, and when they're discharged the initial time, we will meet them the day of their discharge and then do their follow-ups in home. That's still kind of reactive, but with the population that we're dealing with, sometimes that's the only way that we can reach them.
Not to overwhelm, in what you're doing, but we have some utility companies, even our own water department, sends out billing. Not everybody gets an actual piece of mail, but is there any way to include some of this information in there where people can contact you?
Definitely, we could do mailers and stuff like that. It's not something that we can currently do just because we don't have the manpower to facilitate it right now. But in the future, once we have more funding and are able to hire people, then that's something that we could definitely do.
Okay, thank you. Thank you, Mayor.
Councilman Brown?
Just have a quick question. Bilingual, is there a bilingual component to this? Considering, of course, I know my ward is 78% Latino, so I'm just wondering if there's a bilingual component.
Yes, there is. So our caseworker that's actually housed in North Las Vegas, she is bilingual English and Spanish. We also have a caseworker, she's housed in the city of Las Vegas, but she comes to North Las Vegas to help out 2 times a week, and she is fluent in English, Spanish, Tagalog. She knows about 7 languages. I can't remember what all of them are right now. So, yes.
Thank you.
Thank you. Seeing no more questions, we would like to thank you for this timely presentation, Ms. Alexandria and Chief McCray. And if you would offer the special hello from the City Council to your Fire Chief, we'd appreciate it. We have Mr. Richard. Did you want to come up and speak on this issue? Thank you very much, ladies.
Yeah, over the years, I have found out that a lot of 911 calls are not 911 calls. But why don't we have another number like that, where, where the thing's not a timely emergency, but it's still important, could be, affect someone's health or well-being. If you call the 311 number for the police, a machine answers, and you might be upset, you might miss the prompts, you could be on there for 8 or 9 minutes, and then the person you get to still isn't the right person. I think we need another number like 911, 611 for something that isn't so time sensitive as someone laying on the floor bleeding to death. Because I think there is a gap here that needs to be addressed. Also, since this type of thing kind of ties in with emergency situations, in that last presentation, did anybody address the issue that 90% of the people that work for this city live somewhere else? And in the event of a major emergency, there's no way they could get to Henderson in time to help us out here? I mean, to me, if we ever have a major event, like airliner crashing here, a major flood, or, whatever, or a major earthquake here, I think we'd be screwed. I really do. Eventually we're going to have to address these issues. And here's something that I'm worried about. The biggest cause of people over 65 dying is heat exhaustion, because they can't pay their electric bill to keep their air conditioning on. And eventually we're going to have a blackout in this city. And my understanding is we don't have anything set up where people who don't have air conditioning can go to stay cool. We don't have any schools lined up to accommodate these people, or any specific places to go. And this is something that's right around the corner. Sooner or later, we're going to have a blackout in North Las Vegas, and we're going to lose a lot of elderly people because they have no place to go. Is anything being done about this?
We have somebody who's going to come up after your presentation and answer some of your questions.
That'd be great. Okay, thank you.
Thank you. Ron, would you please come forward?
Thank you, Mayor. Needless to say, I wasn't expecting to talk on this issue, but he brought up some very, very good questions. Besides us, our company doing continuity of operations and business continuity plans, we just finished with the 211 disaster response plan for the entire state of Nevada. And what this does, it answers a lot of questions. If people don't know about 211, it is a information and referral service that's located at Financial Guidance Center here in Las Vegas. Okay, they take over 10,000 calls a month already. And this is on any type of information service in human nature, whatever it might be. I've been working with Carlito. In fact, I'll turn around with Sarah. Sarah is very familiar with the 211 program. And the idea behind 211 is that 911 gets called on everything. And that's unfortunate, because I think the way I look at 911, it's an absolutely superb service, but it's overutilized. It's got too much it's got too much out there. Everybody knows about 911. Now, not many people know about 211. And even though they get 10,000 calls a month already, we just finished this plan. What happens if there's a disaster like the gentleman just mentioned right now? This plan, it can actually be activated by any emergency manager in the entire state of Nevada. It can be activated by Carlito. It can be activated by the emergency manager in Clark County, by Washoe County. Any county manager can activate this plan. What it does, it activates You sit down with the PIO, you get all the information out. All that information with the 211 liaison is automatically shifted and gets to the 211 people, and they can answer calls from any citizen in the entire area that is affected. The big example is that the Little Valley Fire up in Washoe Valley back in last November, that activated 211. The flooding in Washoe County, that activated 211, and they took over 1,500 calls in less than 3 days. So, folks, it's out there. 211 is available now. We just finished this project that was almost a year in the making to completely take care of the gentleman's issues that he was just talking about. So I just want to let you know it's there, and Carlito has this. It's in his possession. This can be available to anybody, especially in the area of government. Any questions?
No, thank you very much for responding. That's better information than we could offer. Thank you very much.
Just thought it might help a little bit.
Seeing no more questions, this was a presentation only. No motion is necessary. Moving on to 19.
Item 19, approve agreement with MorphoTrack LLC to provide a new server and a state-required FAP30 device in the amount of $82,000 for additional support service of the police department's automated fingerprint identification system for possible action.
Thank you. Councilor, any comments or questions on this item? If not, the chair will take a motion.
Move to approve.
We have a motion. Please cast your vote. Items approved.
Item 20, approve professional engineering services agreement with VTN Nevada in an amount not to exceed $329,440 from Clark County Regional Flood Control District funding to provide professional design services for the North 5th Street Collector Project, Centennial Parkway to Deer Springs Way Project, CIP project number 10390 for possible action.
Thank you. Councilor, any comments or questions on this item? If not, the chair will take a motion.
Mayor, I'll make a motion to approve, please.
We have a motion. Please cast your vote. Items approved.
Need a bottle of water?
Moving on to ordinances, introduction only.
There is no public comment for these items, and no action will be taken by the council at this meeting. If you wish to speak on any of these items, please attend the meeting where the final action will be determined and submit a blue card to the clerk. Item 21, introduce ordinance number 2812, amending section 010 of chapter 16 of title 17 of the municipal code by reclassifying approximately 7.93 acres therein from an R4 high-density residential district to a C2 general commercial district, ZN 1017, Deer Springs, North 5th, for property generally located at the northwest corner of Deer Springs Way and North 5th Street, and providing for other matters related thereto. Set final action for June 21st, 2017. Item 22, introduce ordinance number 2813, amending section 010 of chapter 16 of title 17 of the municipal code by reclassifying approximately 18.88 acres therein from an OL open land district to an RCL single-family compact lot residential district, ZN 0917, Richmond American Homes, for property generally located south of Ann Road, approximately 200 feet west of Camino Norte, and providing for other matters properly related thereto. Set final action for June 21st, 2017. Item 23, introduce ordinance number 2814, amending section 010 of chapter 16 of title 17 of the municipal code by reclassifying approximately 34.29 acres therein from a C2 general commercial district to an RCL single-family compact lot residential district, ZN 1117, Centennial and Lamb, for property generally located at the northwest corner of Lamb Boulevard and Azure Avenue, and providing for other matters properly related thereto. Set final action for June 21st, 2017. Item 24, introduce ordinance number 2816, amending portions of ordinance number 1722 to reduce the principal amount of assessments levied against properties within the city's special improvement district number 60, Aliante, ratifying action taken by the city officers towards such amendment and providing other matters related thereto. Set final action for June 21st, 2017.
Thank you. Moving on to ordinances, final action.
Item 25, pass and adopt ordinance number 2783, extending corporate limits of the city of North Las Vegas, annexing a annexing a parcel of land generally located at the southwest corner of Van Road and Beasley Drive. Petitioner represents 100% of the area proposed for annexation and providing other matters properly related thereto. continued May 17, 2017, effective date June 14, 2017, for possible action.
Thank you. Council, any comments or questions on this item? If not, the chair will take a motion.
Move to approve.
We have a motion. Please cast your vote. Items approved.
Item 26, pass and adopt ordinance number 2811 concerning the City of North Las Vegas, Nevada Special Improvement District number 65, Northern Beltway Commercial Area, and assessing a portion of the cost of local improvements against the accessible lots, tracts, and parcels of land benefited by said improvements for possible action.
Thank you. Councilor, any comments or questions on this item? If not, the chair will take a motion.
Move to approve.
We have a motion. Please cast your vote. Items approved.
Item 27, pass and adopt ordinance number 2815, creating the City of North Las Vegas Economic Diversification District Number 1, FF Inc., and providing other matters related thereto for possible action.
Thank you. Any council, any comments or questions on this item? If not, the chair will take a motion.
Move to approve.
We have a motion. Please cast your vote.
Councilman Churchill?
Items approved. Moving on to appointments.
Item 28, appoint city council member as a representative to the Southern Nevada District Board of Health for a 2-year term ending June 30th, 2019, for possible action.
Thank you, council. Every one of us sit on a different board and a different obligation and responsibility for the city. We're going to hold this. If you are not satisfied with the board you're on, or you'd like to get on another board, or maybe trade with another member or something, this would be the point to start as these start coming towards us. So we're going to hold on this and let and have that discussion. You know, maybe I get off this board and somebody gets on that board, that kind of stuff. So if you have any in the next little while recommendations or what you'd like to do, come see me on that one, okay?
So, Mayor, are we
Hold
continuing
that
it?
for 2 weeks?
2 weeks?
Yeah.
Thank you. So is that a motion to continue it?
Yes, ma'am. Items approved.
Item 29, appoint at-large citizen member to the Southern Nevada District Public Health Advisory Board for a 2-year term ending June 30th, 2019, for possible action.
I'm asking that we move this for 2 more weeks also. We've sent some names over to Mr. Eisner at the Southern Nevada Health Department. He's going to talk to his people, let them know what the obligations, responsibilities of being on the board were. So if we could move this for 2 weeks, we'd like to do that too. So that's my motion. Let's cast your vote. Items approved. Moving on to city manager's report.
No additional items to report, Mayor. Thank you.
Thank you very much. Moving on to council items. Council, do you have anything you'd like to bring forward? Good things happening in your district, or things you'd like to get out coming in the future? Councilwoman Wood, we'll go to you first.
Well, there's been so much, but I do want to say that I'm thrilled to hear that we have another Police Academy graduation coming up on June 28th at the Orleans, and that means some new officers coming on board again for our city. So that's something I'm very excited about attending. So,
Councilman Barone.
Thank you very much, Mayor. One thing I wanted to do is I think he's watching out there. We have a fantastic employee looking out for our city interests, Mr. John Runix. I know I shouldn't pick out any one person in particular, but I mean I have a citizen concern. There might be a fence down somewhere. There might be something stuck where it's kind of like affecting the public right away. I just make one little phone call to John Runix, and the man. I mean, he's I'm not sure. I heard that Superman had retired. I don't think so. I think he just relocated to Las Vegas. I think his name is just John Runix. So I know he's watching that. There's a shout out to him, and to and I guess I should not praise anyone in particular. I know it's an all team, but he's one of my go-to guys. Anyhow, as people came into the city council meeting, you might have noticed some new artwork that's out there. I already forgot the name of the show. I'm so sorry, but I think there'll be a reception for the newest art show that's coming. The newest art show is coming out, and this is a fantastic display by some nationally known artists. And some of them are, I'm not hawking them for sale, but if you notice, they are for sale as well. I'm probably going to buy a couple. And I guess as soon as I find out when the reception is going to be, I ask everyone to please join us. Maybe I'll sponsor some tea and coffee and donuts and whatever else I can afford, And I urge everybody to come on by and enjoy some fantastic art.
Thank you very much. Councilwoman?
Just to remind you that on June 17th from 11 o'clock to 1 o'clock at the Pearson Community Center, myself and along with the North Las Vegas Police Department are going to host a community safety fair. And we're just learning how to protect our families, our homes, our automobiles, and just answer a lot of what if questions or what do I do questions. And just thought about the presentation we just had from the Southern Nevada CHIPS. That would be a great opportunity to have some of those questions answered. So if you're available, we're going to reach out to you, but we'd appreciate it if you would participate.
Thank you, Councilman Churchio.
Thank you, Mayor. Just want to thank Grace Point Church and the other nonprofits. I believe it was World Church and Sorority from Dellen. Was that the UNLV that came out? For the hard work that they did in both Discovery Park and Seastrand Park. Painting, cleaning. They did amazing work. I don't know how many pine cones they picked up, but I lost count after 2,000. So, we owe a debt of gratitude to those people for taking their personal time to do that on the weekend, on a Sunday as well. Thank you.
Thank you. And I'll just say, Madam City Manager, to have your Public Works Department win 2 awards. Every time somebody in this community wins an award, we all share and bask in that limelight. Appreciate you and your leadership and Jennifer for working so hard. And we look forward to winning a lot of awards. And anywhere there's an award available, we want to compete for it. So congratulations. Thank you. The John Runix Award?
I think is John Rooney in Public Works out as well?
No.
He is.
Yes,
He is. And I'll be sure to get him outfitted for a cape. He will love that.
Isaac's going to put a little something in his Christmas bonus this year. All right. This is the time set aside for public forum on tonight's agenda. Madam City Clerk, do we have any blue cards at this time?
We've given you the ones that we
Mr.
have.
Burchard, please come forward.
Okay, 2 weeks ago on a Sunday, which is the Lord's Day, I got a robocall from Mike Yarder telling me that Anita Woods does not care about the safety of the police department, that she is totally unsympathetic for the policemen who have died in the line of duty, that she needs to be replaced by Scott Black, who has no experience. And it kind of upset me since it was all a lie. I talked with Mike Yodel, whatever his name is, on Monday. He also told me that all 300 of his police officers hate Anita for the horrible things she's done to the police department. And I went out and I spoke to about 15 policemen over the last couple of days. They don't even know who Anita Wood is. Who's Anita Wood? We don't live in North Las Vegas. Who is she again? And they don't hate her. I guess there's no rules in politics, but there should be. Because I want to say something. Anita Woods is not a friend of mine. We don't hang out together. I do not agree with everything Anita does. However, I want to say this about Anita. She is the most experienced, the hardest working, and most qualified person on this 5-member group here. She has done an overall great job for this community, and she has been more than fair to the police department and the fire department. I've always had respect for the law, because without law we have anarchy. But boy, I just resent the fact that since 90% of these people don't live in this city, they don't pay taxes in the city, they don't have the right to vote in this city because they don't live here. but they still have a bigger impact on these elections than I do, because they have the money, and where did that money originally come from? The taxpayers. Also, I got a little thing in the mail by the PAC group that is sponsored by our mayor, saying that last month she only worked 6 hours. This is every time I go to I have a community meeting, she's there. And I don't go to all of them. She goes to every one of them. She's working 60 hours a week. She's filling in, doing things that the part-time people can't do. And, God bless her. If we lose her, this city is going to go further down the tubes. And I just hate the rotten, crappy politics of this city. Have a nice day. God bless.
Thank you very
I've got
much.
some more time left.
Oh, we're done.
Huh? We're done? Okay, fine. I'll just use that time next time. Okay, have a good night.
Thank you. Seeing no one else coming forward, this meeting is adjourned.